The pandemic may be over, but COVID is still lurking around. I think all of us know someone who recently tested positive. But for some people, the impact of COVID can last for months. Dr. Christina Captain is the lead practitioner at the Sarasota Center for Acupuncture and Nutrition, and she's here with us to talk about long-haul COVID. All right, this is something that a lot of us have heard about. It's become kind of a buzzword, obviously, in the medical community. But what does it mean, and how is it different?
So, as you say, people test positive for COVID all day long, every day, all the time now. And we're not seeing as much death from it, luckily, maybe because of the vaccine, maybe because we're getting a little bit of immunity. The problem with long COVID is that it can last not just for months, but years. And we're talking about it makes a significant change in the body. So in my observation, when patients come in, they had a weakness of some kind, whether it was cardiovascular. So now that they've had COVID, these protein fragments, spike proteins from the virus itself, invade the body and cause this underlying inflammation that makes the body go out of control. So in people with cardiovascular weakness, a lot of times they come up with tachycardia, which is rapid heart rate, or AFib, atrial fibrillation. So these are serious problems that need to be seen by your primary care and cardiovascular specialist, cardiologist, right? But these are patients who never had this before, and all of a sudden they have high blood pressure, all of a sudden they have AFib or tachycardia. People have digestive problems. First, they started out with an inflamed gut. They had issues with overgrowth of bacteria or pathogens or parasites. Can't imagine how many parasites I find in stool testing now.
Oh, I don't want to.
You don't want to know.
Yes, I believe.
But it's true. And can cause all kinds of inflammation. COVID comes with their spike protein, and boom, inflammation. Now they get gastroparesis diagnosis, which is a paralyzed stomach. They have a full-time diarrhea, full-time constipation. They can't eat. Serious issues. You have patients with neurologic issues. Dizziness, vertigo, paresthesias and neuropathies in their hands and feet, can't walk, out of balance, don't know what they're doing. Then you have shortness of breath, and the overarching one is fatigue. Oh, yeah. Terrible, terrible fatigue. How is this caused? By the inflammation that COVID spike proteins is causing, or when it just runs rampant in the body.
This is what's happening in the body that we don't really see.
You can't see it. So all of a sudden you just show up. Maybe now you have diabetes. Yesterday you didn't. You know, but you had blood sugar metabolism issues. You were borderline. You were just before pre-diabetes. You get COVID one time, maybe two times, and bam, a month later, your full-blown diabetes can't be controlled. How is this happening? Medicine doesn't know what to do with it. We treat as we always have in conventional medicine. We're going to treat you like you're a diabetic. We'll treat you like you have a heart problem. We'll treat you like you have asthma. Lungs shutting down, neurologic, we don't know. Maybe we treat you with marijuana, cannabis. Maybe we treat you with drugs. But we're not getting to the root of the problem.
Gotcha. So it was interesting because different strains of COVID, I know the medical community was identifying, oh, these are the symptoms. But in this case, it sounds like with long-haul COVID, there can be things popping up that maybe a month, a year down the road, I'm having stomach issues, and I wouldn't necessarily think it had anything to do with COVID. This is where it lies in your hands. Migraines,
eye problems. I see all of this all day long because how it combines with conventional medicine. Yes, we need to get rid of the virus. Yes, you can take your Paxlovid, whatever you need. However, how do we get rid of these long haul symptoms? We have to get to the root, to the inflammation, the inflammatory process. We have to reverse that. And we have been seeing in my practice with long haul COVID, acupuncture and herbal medicine and a couple of secret modalities that help with this long haul issue and getting people better. They can eat again. Right?
So people might be, I mean, it's scary because it's new, but there are things that you can do, like you're mentioning acupuncture. Tell us a little bit more for someone who might be a little bit nervous about something that might come up after having COVID. What can you offer to them that would put them a little bit at ease, or at least get ahead of?
You just need to, take care of your health, obviously, but if you can't get out of bed because of the fatigue and you just can't handle any life activities because of that, that's the first thing. We need to rejuvenate you and get you back in, right? So obviously, getting your sleep, eating healthy, drinking clean water, getting detoxified, getting some testing. So there's a Bruce Patterson, he's a virologist. He worked with HIV a long time ago. He's researching these COVID spike proteins, and he has specific testing, blood testing, that we've incorporated in the practice to actually look at those inflammatory processes and then treat them specifically with nutrients. We're not using drugs at Sarasota Center. We're using all, I hate to use the word natural, we're using all non-invasive and nutrient processes and substances to help heal you.
This puts us at ease because it can get scary, but it's nice to know that there are multiple ways that you can approach this to keep yourself healthy. Keeping us healthy is what you do so well, and so I'm keeping my health in your hands. You can get more information about all of the different modalities that are available with Dr. Captain and her team by visiting their website, scansrq.com. We'll be right back.